Hey guys, Dr. Mandy here from Proactive Health Group, and I just wanted to make a quick video for you guys today about one thing you can start implementing to decrease the chances of you getting a severe outcome from the virus that's circulating right now. So maybe you've heard of this virus. It's pretty contagious. It's so contagious that despite wearing masks, despite closing businesses and social distancing, it's still spreading quicker than we'd want it to. And so I think one thing we need to do is really change our mindset and not be fearful of catching it, but implement things that are going to prevent us from having a severe outcome, because that really is the big issue. I mean, we don't want to be overwhelming our hospitals. I mean, ideally, we don't want to be even having to go to the hospital if we get this virus. We want to be able to manage it at home. Maybe we're uncomfortable for a couple days, but then bounce back. And we also don't want to be spreading it to vulnerable populations and them having severe outcomes. So one thing that you can start doing to decrease the chances of getting a severe outcome from this virus is ensuring that you have adequate vitamin D levels. I really should word that differently. Sufficient levels of vitamin D in your blood. So this is something that can be tested, but if you're not supplementing vitamin D, if you live in Canada or even further north than 35 degrees latitude, you can bet that you are deficient in vitamin D. And maybe not even deficient based on the definition, but have insufficient levels. So we know based on the research that there is an inverse relationship between vitamin D levels and severe outcomes of the virus that's circulating. There was a meta-analysis done on 27 different studies that all showed, the conclusion of the meta-analysis, I should say, was that people with insufficient vitamin D levels were 64% more likely to have a severe outcome from this virus. So what we would recommend you do is make sure that your vitamin D levels are sufficient. You can test them, or you can just start supplementing vitamin D. I mean, it's really safe. It's possible to overdose on it, but you would have to take a super, super high level. So I highly doubt anyone is going to be taking, like 40,000 IUs a day. Don't do that. But what you can do is take about 35 times your body weight in pounds, round that to the nearest 1,000. That would be how many international units you should take of vitamin D. So for example, if you weigh 150 pounds, that would be about 5,000 IUs of vitamin D that you should take per day. We recommend taking an emulsified version, so a liquid vitamin D is best, and it's easier to take a liquid vitamin D compared to a tablet. It's a little bit better absorbed with food and best to take in the morning. So we sell a great brand that I know and trust here at Proactive Health Group. I mean, this isn't a sponsored video, but here the brand Genestra is what we use at Proactive Health Group. This little bottle lasts a really long time. It's definitely an affordable supplement to take, and the fact that it's so immunoprotective, it's something we all should be doing, especially if we are living further north than, as I mentioned, 35 degrees latitude. If you live closer to the equator and you're outside in the middle of the day, you probably don't need to supplement vitamin D. But this video is mostly for us Canadians who are really far north. Even if we're getting outside, the sun's rays are not at a sufficient angle to activate vitamin D. If you want to look that up, just Google zenith angle and you can get more information about that. But hopefully you guys found this video informative. Hopefully you start supplementing vitamin D. If you want to get your levels checked, come see me at Proactive Health Group. I can help you out with that. Or if you want an individualized dose, I can also help you with that. So if you like this video, give it a little double tap. If you have any questions, just post them down below. That's all for now. Have a great day, everyone.